Okay, so now that we're done with that part of the examination, I just want to walk you through what's going on and what you can expect through the rest of physical therapy. So what I suspect that you have is called a herniated disc. What that is basically your spine is made up of some bones that are stacked on top of each other like this, and you do have stuff that runs out through them, and those things that branch out are called nerves. And those are going to go through your arms and your legs and the rest of your body. You also have something else in between those bones, and those are shock absorbing pads, and those are also in between, right? And those are called discs. What's going on is that because there is more pressure on some of your bones, one of the discs is being kind of squeezed out a bit, and so it's providing pressure on one of those nerves, and that is what is causing the pain in your leg. But the good news is that you're a great candidate for physical therapy, and most patients fully recover within a few weeks. The exercises that I'm going to teach you, along with the physical therapy treatments, are going to help relieve some of that pressure. So what that means is that it's going to, by strengthening your muscles, and the way that you were reacting to the treatment was that we're kind of helping that pull apart a little bit and relieve that pressure. And we also want to keep in mind that since you are lifting some heavy objects at work, we want to make sure that you don't get hurt again. We want to make sure that we don't delay your healing process, right? So just kind of keep in mind when you're lifting to kind of maintain that proper form. So keep your back straight, push off with your legs, and try to avoid picking up and twisting, okay? And I would like to see you twice a week for the next 6 weeks, and we'll talk about which times and days work best for you, okay? I am concerned about your blood pressure. It seems to be a bit high, so I would like you to see your primary care provider for this reason, and I will also be giving him a call just to check in. And I will be doing this because your safety is what's most important, okay? Also, regarding your first concern about why you're having back problems at the age of 35, this injury is most common within the ages of 30 and 40, so you do fall within this range. Also, I just kind of want to give you an example. So kind of think about a car. So when you buy a brand new car, it works perfectly. You really don't have any problems with it. But as time goes on and you're putting miles on it every day, maybe in the next 10 years, you might experience some problems. Well, our bodies kind of work very similar to that. With time, we're going to have some changes in our bodies. So don't be too worried because like I said, it is common within this age group. Your second concern was regarding your job, and you asked if this issue is just going to keep happening to you. And the answer is that because of your job requirements, you're lifting and you're sitting for very long periods of times, along with those natural body changes that we talked about. It is likely that you might experience some of these symptoms again, but like I mentioned with these exercises that we are teaching you, you will know how to relieve, how to lessen that pain. And just remind yourself to use those proper forms when you're lifting, or also when you're just sitting and driving. So I do have 3 exercises that I want you to do at home. And so the first one is going to be, you're going to be on your stomach. It's called a press up. You're going to have your arms out here. You're going to press up slowly. You're going to be arching your back. You're going to hold it for 2 seconds, and then you're going to relax. You're going to do that one 8 times, 3 sets, 2-minute rest in between. You're also going to do another one that is also going to be on your stomach. It is called the Superman. So just have your arms out in front of you, straight, and also your legs. And what you want to do is you want to lift them at the same time while you're keeping your core tight. So it's going to look like this. Hold 2 seconds and relax. You're also going to do that one 8 times, 3 sets of 8 with the 2-minute rest in between. And you the last one is called a hamstring stretch. So you want to sit at the edge of a chair. You did have some tightness in the back of your legs, so you want to make sure that you keep your legs straight, keep your toes pointed up towards the ceiling. And you're just going to be sitting up straight, and you're going to slowly lean into it, leaning down, and you want to feel that stretch back here. You're going to hold it for about 30 seconds, and you're going to do it twice. And that's it. That's about all that we have for today. Do you have any other questions? Is there anything that I can help you do before you leave? It's been a pleasure taking care of you. Let me walk you out the front so we can schedule the rest of your appointments.